Okay, you ready?
Yes, ma'am.
Very good. Okay. Good afternoon, everybody. Actually, I want to begin today with some positive economic development news. You might remember that last year, CNBC named Kansas the comeback state for 2019. Well, then just yesterday, in Site Selection Magazine's annual rankings, Kansas experienced the most dramatic jump in economic development success of any state in 2020. We moved from 20th on the list in 2019 to 10th in the nation in 2020. Now this comes just a few months after I announced that Kansas had broken the record for new capital investment in 2020, bringing in more than $2.5 billion through economic development projects. So as we continue to recover from this pandemic, our ability to keep existing businesses, attract new ones, and create new jobs will be critical. Our new site selection ranking is a testament to what we already know, that Kansas is on the right track. My administration is committed to keeping up this momentum. We're rebuilding our state's economic foundation to ensure that Kansas comes out of this pandemic stronger than ever. Now moving to the numbers. Since Monday, Kansas has reported 778 new positive cases and 35 new deaths. This brings us to a total of 297,229 cases, 9,467 hospitalizations, and 4,851 deaths. Since the vaccine first arrived in Kansas, my administration has prioritized getting shots in arms as quickly and as efficiently as possible. For much of the past few months, a national vaccine shortage was our biggest barrier to success. But Kansas is receiving more and more doses every shipment, and we expect these increases to continue. This week, we got approximately 130,000 doses combined of the Moderna and the Pfizer vaccines, and we will receive more Johnson & Johnson doses later this month. We got some last week. There's going to be a 2-week lap, and then we're going to see a very significant jump in the Johnson & Johnson doses. All of this is making a difference. Over the past 2 weeks, Kansas has had a 52% decrease in cases and a 62% decrease in deaths. Hospitalization rates continue to drop. We've seen a 35% decrease over the last 2 weeks. While we are making progress, some communities still encounter unique barriers to getting vaccinated, particularly our communities of color. Yesterday, I toured Wyandotte County's 3rd mass vaccination site and spoke with the county's Health Equity Task Force to get some ideas on how we as a state can improve vaccine equity efforts. Throughout the pandemic, Wyandotte County prioritized ensuring vulnerable communities have access to testing services and then to the vaccines. Their approach is a model for how to do it right, a template that my administration plans to use to bring into other communities. We're taking other meaningful steps to achieve a more equitable and efficient distribution plan. We now are publishing a race and ethnic vaccine data on the KDHE dashboard. We have implemented the administration's new meatpacking workers vaccine plan, which is moving very quickly. We anticipate that all meatpacking workers who want to be vaccinated can receive their first dose by the end of next week. And we've also brought on board as special advisor to the governor for COVID-19 vaccination equity, Dr. Jimena Garcia, who will coordinate efforts among the Hispanic and Latino American Affairs Commission, the African American Affairs Commission, the Native American Affairs Commission, and the Kansas Department of Health and Environment to ensure that we're maximizing our delivery and administration of the vaccine in our socially vulnerable communities. Dr. Garcia joined me at the roundtable yesterday to seek advice from Wyandotte County's Health Equity Task Force. We both came away with valuable information that will inform our work in the weeks and months to come. I will let Dr. Garcia introduce herself here in a moment, and when she does, you will see that she is highly skilled, highly qualified, and highly passionate about this mission, and I am really fortunate to have her on my team. Before I turn it over to Dr. Garcia, however, I want to give an update from the Kansas Department of Labor. As I mentioned last week, the agency continues to onboard its 500 new customer service agents and surge staff. Our extended hours started this past weekend with added time on Saturday and Sunday. Our call centers are now opened until 9 p.m. during the week. We'll continue to add resources at the call centers as we move forward. We've also kept up our efforts to increase communication with the people of Kansas to ensure everyone has access to the facts. Today, I want to alert Kansans about a recent uptick in fraudulent Facebook accounts posing as Department of Labor accounts. As with all unemployment fraud, this is a challenge that every state is facing. The United States Department of Labor has created a task force to work with social media platforms, and we're coordinating with our federal partners. However, we need Kansans to remain vigilant. Please do not provide personal information via social media sites. If you think you've encountered a fraudulent site, it's important that you do not click on any links or provide any information to these accounts. If you receive a message or comment from one of these impersonating accounts, report it immediately to Facebook, Twitter, or whichever social media platform you're using at the time. And here's a few simple steps to determine if the social media account is fake. Check the name of the account for spelling errors or letters replaced by numbers, like using a 0 instead of the letter O. Check that the handle is correct. Department of Labor's Facebook and Twitter handles are both at Kansas, spelled out DOL. Check how many likes and followers the page has. The official KDOL Facebook page currently has over 30,000 followers. Finally, check that the correct website is listed on the page. It should end with .gov. Please make sure to only use the websites getkansasbenefits.gov and pua.getkansasbenefits.gov when accessing your unemployment benefit account. KDOL does not ask for your personal information like your social security number or your bank account information via social media. In addition to reporting these fraudulent accounts to the social media platforms, I'd also encourage you to report them to KDOL by email at kdol.fraud@ks.gov. This will help us shut these sites down and warn the public of their existence. And with that, I'll now hand it over to Dr. Jimena Garcia, Senior Advisor for COVID Vaccine Equity. Dr. Garcia.
Thank you, Governor. Hi, everybody. I've lived in Topeka for 18 years. I came to Kansas for medical school a long time ago, and I returned for love. I've lived here longer than I've lived anywhere else. I was born in Los Angeles. My parents are immigrants from Chile in South America, but I have lived in cities all over the U.S. I've really found my community here in Kansas, though. I've practiced medicine in a variety of settings and places, but I've always been drawn to working with underserved populations. My most recent experience was here in Topeka, seeing patients at the Marion Clinic, which was a clinic for people without insurance, Medicare or Medicaid. I saw patients there as a volunteer for over 10 years until the clinic was closed a few years ago. I am really honored to have been asked to serve the state of Kansas in the role of Senior Advisor for COVID Vaccine Equity. It's a really extremely important issue and one that I've been following closely. The data has shown that the coronavirus pandemic has taken a huge toll on communities of color. These communities have people who are overrepresented in frontline essential jobs and vulnerable to risk factors that can make COVID-19 worse. In Kansas, rates of death from COVID in people of color have been substantially higher than rates of death in the white population. In Kansas, the data show that we are really not where we should be in terms of vaccine equity among our populations of color. I've been in this position about a week, and I've literally hit the ground running and will work hard to understand where the gaps are. Just yesterday, I had the opportunity, as the governor mentioned, to tour the Wyandotte County 3rd mass vaccination site, where we were able to sit down with the race and equity group and really learn about their strategies and their successes. There's really excellent work going on in many local communities, and we need to work at the state level to support and amplify their efforts. I'm really excited to serve in this administration, and I'm really ready to get to work. And with that, I'll turn it over to Dr. Lee Norman, Secretary for the Kansas Department of Health and Environment. Mr. Secretary.
Thank you, Dr. Garcia, Governor. Good afternoon. We've talked for a few weeks about the gap between the administration of the vaccine and the doses that we've been delivered. And we've talked about the diagnostic that we're going through. And I'm real pleased to say that I think we've gotten, even just since last week, a lot of understanding that essentially the numbers that you've seen reported that are lower than what we think they are and should be fall into two buckets. One is the data interface issues, which will require a technical fix, which is ongoing. And the second is some doses that are in inventory that are not yet injected into people's arms. What we have found through this analytic that we did was that the extreme cold weather of 2 weeks ago resulted in no vaccine being delivered into the state of Kansas, and then last week a significant amount of catch-up as a double dose of everything came into the state. This meant that all the counties that received the delayed vaccine was allocated in the current week. Receiving this increased amount of vaccine has created a backlog, which we're cleaning up now. And let me give you an example of what we're doing right now. One of the locations with inventory on hand is Sedgwick County. We have contacted them and are working with them. We helped them to get the vaccine out as quickly as possible as we move through phase 2. To do this, we will be sending National Guard staff to Sedgwick County tomorrow to start doing mass vaccinations in a church that has been identified and volunteered to be the site. We will have Guard staff on hand along with Public Health Department staff as long as is needed to catch up with this backlog. If you are a Sedgwick County resident in phase 2, please reach out to the local health department, as that's where the scheduling is going on. We're grateful for the Central Community Church for volunteering to be the vaccination site, and we're pleased to deploy Kansas National Guard troops for this purpose. That's but one example for cleaning up the backlog, and we hope that we'll start seeing quite different numbers reported to the CDC COVID site, for example, in the next week or so. That's the end of my comments. Back to the Governor.
Okay, any questions?
Yes, Dr. Norman, how many National Guard troops are these Army or Air or both, and how many are we talking about?
I believe it's Army, but I'll have to get back to you on whether it's Army or Air. We're going to have 3 teams of 6 in each team. Tomorrow, 2 teams will go down there, and then a 3rd team will be added on the following day.
Governor, with the positive trends, the pandemic heading in the state, do you think we're turning a corner?
Actually, I do. I think, we've already seen the CDC guidelines come out that allow for people to start gathering if they've been vaccinated, or if this one family hasn't, but you have, that they're loosening up those kinds of guidelines. I think we're going to continue to see that as the numbers deem. Fewer cases, fewer hospitalizations, fewer deaths, and more vaccinations. So yeah, I do think we're getting very close to being able to open up more significantly.
And do you have a response to the bill that was introduced to the Senate that would lower the state's availability to prevent counties from moving ahead with vaccinations?
Yeah, I saw that bill, and the fact of the matter is, we are following CDC guidelines. We are trying to get the people in phase 2 all vaccinated, and then we'll move into phase 3. Phase 3 is not very far behind right now, so my guess is the bill is unnecessary. We're going to be moving anyway very soon, but I really think this is one of those cases where there are other things the legislature ought to be focused on.
Well, Governor, the sponsor of that bill said it's extortion or, can't remember the other word, it was in that thing. Blackmail, yes, sorry. Blackmail to have this policy of withholding vaccine doses if your county is finished with phase 2 and would otherwise use the doses to move on to phase 3. What's your response to that?
Well, I'd like to think that Kansans are all in this together, and that because a county, maybe usually they're very small counties, were able to get through their phase 2 more quickly than some of our larger counties because they got more doses per capita than our larger counties. That they would see this as part of the greater good in helping their neighbors out. So, it's not extortion, it's not blackmail, it's just being a good neighbor.
Governor, I saw yesterday you said that we're probably not moving into phase 3 for another few weeks, maybe early April. I don't know that the counties that are in a holding pattern in vaccination until then would classify that as soon. If it's 3 weeks where they're not really able to move forward.
Yeah, well, we just threw that out. I told you yesterday that couldn't give you a drop dead date. So we just gave you that, knowing that no later than the beginning of April will we do that. We have very high hopes that we'll be able to move more quickly than that, particularly if, as we expect, the Johnson & Johnson doses will be coming in, and they'll be coming in quite significant quantities, which will allow us to fully vaccinate thousands of people much faster than we had anticipated.
Governor, we're seeing other states get rid of mask mandates and open up with less restrictions. Right now, the state of emergency is supposed to end on March 31st. Would that get rid of the mask mandate in the state? I know it's still up to county officials, but maybe they won't fall back on your recommendation. What would happen if that is the case? Are you worried about that?
Well, the mask mandate is the least of my worries if the emergency declaration is not extended. That's just one thing that would happen. The other thing that would happen is we would not be able to deploy the National Guard to Sedgwick County to help them out with their mass vaccination sites. We wouldn't be able to use them to deliver vaccines to more remote areas. There are all sorts of other horrible things that will happen that are not good for Kansans and not fair. So the mask mandate is the least of my concerns about that expiring.
Should counties be getting rid of mask mandates yet or opening up to full capacity when it comes to businesses and restaurants?
If I thought that they should be doing that, I would make those recommendations. Right now we put out the CDC guidelines for loosening restrictions, and we are meeting on a regular basis. In fact, just yesterday, I met with representatives of the business community, and they're working this week with their members and their various industries to determine, much like we did at the beginning when we were shutting things down and then wanted to have a phased reopening, when we thought maybe we'd be getting through this a little faster than we have. We worked with our business communities to determine how we could reopen most safely, over what period of time. We're sort of going to return to that, and we've asked them to come up with, a phase of what would we do when, in what order, to be able to reopen as safely as possible, but as quickly as possible.
Governor, there's this developing argument amongst Republicans that some of the things you did, closing school buildings, the statewide stay-at-home order, the initial order with churches around Easter time, you were too aggressive. and it did too much damage to the economy. The Attorney General, who, as you know, launched his campaign yesterday, said that a lot of voters are disappointed in you, and they didn't anticipate, in his words, having somebody who would instinctively look to shut things down in the face of a public health emergency. What's your response to all that?
I think it's really easy to be a backseat driver. When we made those decisions, we made them based on the information that we had and that we didn't have. You have to remember this was a year ago. We didn't really know what this virus was going to do. We didn't know how it really spread. There were just so many things. We didn't have PPE and other kinds of supplies and equipment to ensure the safety of our frontline workers. We didn't know how kids were impacted by it. There were just so many unknowns. And the safest thing to do then was to do exactly what we did, was to shut it down, get the kids online, and then assess how we could reopen businesses safely. And that's exactly what we did. We didn't shut down businesses for long. We worked with them to figure out ways that they could reopen and start doing business again.
Governor, how can a county that doesn't have a state of emergency declaration continue getting COVID funding and supplies from the state? And are those counties forgoing any aid by not having those emergency declarations?
I'm not sure I understand your question.
Like, if a county isn't following your state of emergency declarations as far as mask mandates or whatever else, how are they still getting aid from the state?
Well, we just didn't choose to punish them. I think that it's as simple as that. While I wish that they would have followed the mandates, and ultimately most of them did. I think we had 80 counties and many cities putting in some of those mandates on their own, and that's good. That's what it should have done. But we're not going to punish the citizens of different counties because of decisions their elected leaders made.
Last question?
Yeah, Governor, do you have any reaction to what's going on with KU athletics, the letting go of the football coach and the apparent firing of the athletic director and that whole scandal over sexual harassment?
Yeah, I really don't. I'm sort of a basketball person, so I haven't been paying a whole lot of attention.
Thank you.